Basically, we hold the baby like a rugby ball, meaning he is no longer in front of us with his body, but he will be sideways. Right, Ambrose? We try to position the puppy on our side. So Valentina comes a little bit further forward because he is long. He is already a big puppy. And we have him looking with his belly at mom's belly, mom's side. So he rotates. In this case, we see that part of his body is behind mom's body. We have to give him room. We slide him a little more back. Again, we approach him with our chin and the nipple points to his little nose. We wait for him to gape and feel like it when he opens his mouth wide. There you go, love. Stop there, that you got on the tip. When he feels like it, there it is. Then this movement that Ambrose did, super. When he's in the mood and he opens his mouth wide open, that's when we bring him closer to the breast. Okay, we can stay for a few more moments holding the breast, or if we feel like it's taken well, that it doesn't hurt and doesn't slip at the tip, we slowly try to let go. Mom's hand slips to hold the root of his neck. Very good. Support the little head well because he doesn't run away back. Okay? In this position, always be careful that the breast tissue is not stretched. I mean, we must not see this because in the long run, a stretched tissue then stretches if it inflames and bothers us, but as close as possible so that it gives us more space. Very good, this. In the rugby hold, we see how Ambrose goes to stimulate exactly the opposite side of the breast where he rests his